Next section is typical metabolic disorders. So question number 52, a patient with diabetes mellitus being unconscious was delivered to a hospital. He manifested respiration of Kussmaul's. The arterial pressure is quite low, acetone odor from mouth, and accumulation of what? So basically he developed diabetic ketoacidosis. Therefore, Kussmaul's respiration is kind of a form of hyperventilation. And hyperventilation, will lead to respiratory alkalosis when excess of the carbon dioxide is removed from the body. So it is obviously ketone bodies. We can even smell a ketone body, that is acetone, from his breath. Next, 500 ml of 5% solution of glucose together with some other drugs was injected intravenously into a patient with liver cirrhosis. So 5% solution of glucose is actually isotonic, but you don't have to look that. See, the patient has liver cirrhosis, means his liver is damaged. Insulin basically acts on 3 tissues. First one being the liver, next the skeletal muscles, and then your adipocytes or your fat cells. These 3 are the main: liver, skeletal muscles, and adipocytes. These 3 are the main target organs for insulin. Now, when the patient has liver cirrhosis, do you think when insulin is there and the liver can take up the glucose? No, it cannot. So there will be increased glucose in the circulation because liver is damaged. It cannot take the glucose. It cannot lead to formation of glycogen. So the glucose will be increased. Now already there is an extra amount of fluid that is added into the body. So this will be your overhydration. But what type of overhydration? There will be hyperosmolar. Because again I'm telling you 5% is isotonic. But because liver cannot uptake, there will be more glucose in the body. And that will lead to hyperosmolar overhydration. Next, generalized edema of patient developed during a complete nutritional starvation. Incomplete, we have already mentioned, that is even what is not consumed. So starvation is of 2 types: incomplete, complete. In incomplete, water is still consumed, and incomplete, even water is not consumed. So what is the mechanism of development of edema in such case? So edema, basically they can be due to decreased oncotic pressure or increased hydrostatic pressure. Now since he is starving, there is no protein intake. When there is no protein intake, there will be no oncotic pressure. Now since there is decreased oncotic pressure, there will be lead to development of edema. So when there is a blood vessel, due to increased hydrostatic pressure, there will be movement of water from the vessel to the tissues. But what is in oncotic pressure? That proteins have the capability to attract water. So when there is increased oncotic pressure, the water will come inside the blood vessels, if we talk in simple language. And therefore when there is decreased blood pressure, so the relatively in the surrounding tissue, the proteins will increase, and this increased protein will attract water. So the water will go from the blood vessel to the surrounding tissue, and therefore leading to edema. During mountain climbing, a sportsman developed severe short breathing, headache, giddiness, palpitation. What type of acid-base balance? At high altitude there is decreased amount of oxygen or decreased partial pressure of oxygen, and patient will feel kind of uneasiness, so he'll start hyperventilating so that more oxygen can come inside the body. But when there is more oxygen coming inside the body, more carbon dioxide is also removed from the body. So that will lead to respiratory alkalosis because the patient starts hyperventilating when at high altitude. Next question. A 38-year-old patient with hepatitis in the past continued to take alcohol. Later symptoms of cirrhosis with ascites and edema of the inferior extremities appeared. And what are the factors for development of edema? So the patient had hepatitis, but he continued to take alcohol. This hepatitis then developed to cirrhosis. Now, when cirrhosis developed, the liver is basically not functioning. It is made up of basically connective tissue now when fibrosis has occurred. So the hepatocytes are decreased. They cannot produce albumin. Albumin is what? Protein. So when there is decreased protein, decreased albumin, the oncotic pressure also decreases. And I already told you, when there is decreased oncotic pressure, edema develops. So here the answer is hypoalbuminemia. Albumin is a major contributor to the oncotic pressure. Next, a 15-year-old boy suffers from alkaptonuria. His urine turns black after settling hereditary metabolic disorder. Which substance is taking place? So I hope you are doing your biochemistry well, and here the answer is what? Tyrosine. A few months after birth, a child develops symptoms of CNS disorder. Skin and hair become lighter. The solution of 5-trichloroacetic ferric lactase added to fresh urine gives it olive green coloring. What kind of hereditary disorder it is characterized by? So this is phenylketonuria, absence of phenylalanine hydroxylase, and in this especially there are mental disorders. And since tyrosine obviously cannot be formed, there is albinism, and this test basically is for phenylpyruvate and other ketones or other metabolites of phenylalanine will be phenylactate and phenylalanine. So next question. A 48-year-old man suffering from diabetes mellitus was hospitalized being unconscious as a result of strenuous exercise. His respiration is superficial, arterial pressure is low, glycemia is low. So you can see it is less than normal. The normal is 3 to 5 millimole per liter. So it is hypoglycemic. Lactacidemic obviously occurs when lactic acid is accumulated. Hyperketonemia when there's ketosis. They'll mention in question the ketone bodies. And hyperosmolar is when the glycemia is more than 50 millimole per liter, it will lead to hyperosmolar glycemia. Next, examination of a child with oligophrenia revealed an increased level of phenylalanine and phenylpyruvate in the blood and neurolymph. The reaction of urine with trichloroacetic acid is positive, deficiency of which enzyme? So this is what, again, phenylketonuria, and I told you it is due to deficiency of phenylalanine hydroxylase. 61. A 3-year-old child was diagnosed with kwashiorkor, and such symptoms such as keratinization, desquamation of skin, adipose, hepatic infiltration are observed. So, you should remember the question as well. Sometimes they will ask you something from the question, and that would be given in your ministry book itself. So you should remember all the symptoms of kwashiorkor. So this is basically protein starvation. I'll insert a picture for difference between kwashiorkor and marasmus. So have a look at it. Next, a patient suffers from diabetes mellitus. Regenerative processes are reduced. The wounds don't heal quickly. So what is the cause of such changes? So when there's diabetes mellitus, there's decreased insulin. When there's decreased insulin, insulin is an anabolic hormone. It leads to lipogenesis and synthesis of protein. So when there is decreased insulin, all the anabolic function is reduced, and therefore there is decreased synthesis of proteins. And for healing processes, what is required? Collagen. Collagen is the most abundant protein in the body, and because there is decreased synthesis of protein, collagen cannot be synthesized, wounds cannot heal. Next, having eaten an orange, a 6-year-old girl developed edema of blepharon, means the upper eyelid, lips and mucosa of the tongue. Earlier, after eating orange, rash and itch appeared. So this is basically your anaphylaxis reaction, because after eating orange, she developed edema and rash and itch within minutes of eating orange. So this is your anaphylaxis. And what happens in anaphylaxis? Permeability of capillary, it rises. So fluid flows from the blood capillaries to the surrounding tissue, leading to edema. 54. Mice with hereditary obesity have hyperglycemia and decreased level of insulin receptors in leukocytes. What is the initial pathogenetic mechanism of intensified lipogenesis in these animals? So he had obesity. Why? And basically, why they're in the question, in the last line, they're asking why there is intensified lipogenesis. So it is because of hyperinsulinemia and not hypoinsulinemia. Insulin is an anabolic hormone. It is an anabolic hormone. It leads to synthesis of lipids, synthesis of proteins, and therefore intensified lipogenesis would always be because of when there is more insulin present. So just look at the question, what they are asking, and not because he has decreased level of insulin, so it should be hypoinsulinism. It is not like that. 65. A patient with third-degree burns had hypoproteinemia and edema. What is the basic mechanism of such edema? In question it said they have written that there is decreased protein in the blood, so there will be decreased oncotic pressure in the blood. Next, a person who has been bitten by bees suffers from edema of upper extremities and face. What is the basic pathogenic mechanism? So this inflammation, or basically it is anaphylaxis reaction. It is because of increased permeability of vessels. Next, a patient with pneumosclerosis developed pulmonary hypertension and dextroventricular heart failure with ascites and edema. What is the basic pathogenetic mechanism? So for the right side of the heart, from the liver, the inferior vena cava, it enters the right side of the heart, and from the right ventricle it goes to the lungs. Now when there is pulmonary hypertension, there will be right ventricular hypertrophy, so much that it will become so bad that there will be heart failure of right side of heart. Now heart cannot pump blood, there will be increased blood in the venous circulation. Now when there will be increased blood in the venous circulation, it will lead to increased hydrostatic pressure in the veins. Simple as that. Next, a prolonged use of mineralocorticoids by patient resulted in muscle weakness. So from mineralocorticoids, the AL in the ending of mineral, remember aldosterone. So aldosterone, what is the basic function of aldosterone is that it takes sodium and it gives out potassium. So the sodium from the renal tubules or from sweat gland, it is from the sweat, it is reabsorbed and potassium is let out. Now muscle weakness, it mainly occurs due to hypokalemia. Potassium is required for the resting membrane potential. So yeah, that will lead to your muscle weakness. A dog is placed into thermostat at temperature 40 degrees Celsius. Developed significant increase of respiration rate. What kind of water electrolyte balance occurred? So when there will be 40 degrees Celsius, the temperature is more than the body temperature, so there will be sweating, so therefore it will be dehydration. But the aldosterone, it not only works on the kidney tubules but also in the sweat. It will absorb the sodium, only the water will evaporate. So when the water will evaporate, osmolarity will increase relatively because there is dehydration. Next, the basic metabolism of rat after 48 hours of starvation with water has decreased by 20%. Respiratory coefficient is 0.7. Lipemia and negative nitrous balance is also observed. What period of complete starvation? So I'll tell you, look at this table. These are periods of starvation. The first one is uneconomical energy expenditure. Second is maximal adaptation, and third is terminal. So the first and second these are the compensatory stage, and the last one is decompensatory stage. The first one occurs within 2 to 4 days, so this is literally your time period. In the first stage, there is uneconomical, means there is no limit to the use of energy, and this energy comes from your carbohydrates. And when carbohydrates are burned, the respiratory coefficient will become 1. Respiratory coefficient basically means carbon dioxide used upon carbon dioxide excreted upon oxygen used. And in the second period, when there's kind of exhaustion of all the carbohydrate stores in the body will now use lipids. Now respiratory coefficient for lipids is 0.7, you should remember it. And then in the last stage, when everything is finished, the body now starts using proteins. The proteins are very essential for the body. Now when proteins are started using, the respiratory coefficient becomes 0.8. So you should remember all the respiratory coefficients and in which period of starvation which substrate is utilized. Now in this question, the respiratory coefficient is 0.7 and lipemia, lipids are observed in the blood. So this is second stage of starvation, that is maximum adaptation. इसके बाद कुछ नहीं कर पाएगी बॉडी, इसके बाद decompensation stage होगा. Next, after 72 hours of experimental starvation with water, the body mass and basic metabolism of rat has decreased. So basic metabolism has decreased even further, and respiratory coefficient is 0.8. It is characteristic of protein, and protein are utilized in stage 3, and that is your terminal stage. So because proteins are utilized, there is decrease in oncotic pressure, there is formation of edema, and this is your last stage of starvation. Next, after 10 hours of starvation, the basic metabolism in the rat is increased, because it is kind of in immediate response to stress. So there will be many hormones released, glucocorticoids, all the stress hormones, glucocorticoids, norepinephrine, epinephrine. So the basic metabolism kind of increases initially, and the respiratory coefficient is 1. 1 is characteristic for carbohydrates, and you see all these hormones in the blood. So this is your period of uneconomical energy expenditure. Prolonged consumption of only carbohydrate food by experimental rats caused accumulation of water in tissues. So he is consuming only carbohydrates, whereas proteins are very important for the body. So when proteins are not consumed, oncotic pressure nahi hoga obviously. So this will be your hypo-oncotic because of absence of proteins. Next, a 12-year-old teenager had abruptly grown thin within 3 months. The level of glucose in blood was 50 millimole per liter, and then coma developed. What is the main mechanism of coma? See, in the question they haven't mentioned of ketone bodies, so ketone will not be. There's obviously hyperglycemia, so it is not. Lactic acid is not mentioned in the question. Hyperosmolar. A patient with the 1 type diabetes mellitus was given an insulin injection. Later, he developed general weakness, irritability, increased sweating. What is the basic mechanism of hypoglycemic? So when there is hypoglycemia, why? Because an extra dose of insulin was given to the diabetes mellitus patient, and these are the symptoms of hypoglycemia: weakness, irritability, and increased sweating. Now basically it is carbohydrate starvation of the brain. When there is hypoglycemia, there is weakness, irritability, all these are basically for your signs of brain. Now another important point that I want you to remember is that for hypoglycemia there develops signs of tremor, sweating. Tremor is basically due to beta stimulation, and sweating, although it is a sympathetic, there is M receptor. So when we give beta blocker to a patient, a diabetic patient, if we give beta blocker, the main symptom of hypoglycemia, tremor, it will not be there. The patient has to rely only on Sweating. So the beta blockers are kind of avoided in a diabetic patient who is taking insulin, because if there is hypoglycemia development, patient will not be able to know and it can lead to complications. Next, during the second period of complete starvation, the level of lipids in the blood of an experimental animal was increased. What form of hyperlipidemia is observed in the case? So this is kind of written in the book only. In the book itself, they are written transferred lipemia is observed in the second period of starvation. So you just have to know. If you look at other options, nutritional, no starvation हो रहा है. How this starvation? How can there be nutritional lipemia? Retentional. There is no such disbalance or disorder of productional. No, no, because not extra lipid is produced inside the body. Lipids are utilized. So already present lipids are utilized, and we just remember it. As a rule, during starvation, the mass of organs and tissues decreases. What organ loses most of its mass during the first period? So during the first period, the carbohydrates are utilized, and the major organ for storage of carbohydrate is liver. You just have to remember it like this. It will be more easy. A patient was admitted to an infectious disease department with complaints of unstoppable vomiting. So you see, a patient has unstoppable vomiting. First of all the fluid is getting out of the body, so it will be your dehydration. Now, dehydration, again, all the nutrients that a patient was supposed to absorb from the gastrointestinal tract, it cannot be absorbed. So, hypoosmolar dehydration. Although you might think that since fluid is lost in the body, they may be hyperosmolar, but since from the gastrointestinal tract all the nutrients or all the minerals were about to be absorbed, but he that cannot be absorbed into the body, so the osmolarity cannot be maintained. It is hypoosmolar dehydration. Next, a group of animals had starved for 10 hours. The concentration of glucose in the blood remained at the lowest limit of the norm. So you should look at the time period. So when there is kind of starvation, first of all, the glycogen, the storage form of glucose, glycogen is used, and that is your activation of glycogenolysis. Now you might think that it may be this gluconeogenesis, but gluconeogenesis, first of all, there is written depression of gluconeogenesis. Gluconeogenesis occurs after all the glycogen storages are used. It occurs mainly after 24 hours. So yeah, that's it for this video. I hope it was helpful, and thank you for watching.